Hello, welcome to the CINCILINGUA membership program and welcome to our live class today. It is great to have you with me for the live class. It is always great to have you with me for the live classes, and it's always great just to have you as members of our CINCILINGUA membership program. And I hope everybody out there is having a wonderful day today. For those of you who have not met me yet, my name is Todd, and I am here in Cincinnati, Ohio, of the United States of America. And I hope that all of you are looking forward to the live class today. Today's live class, we are going to be focusing on some everyday English, or some English that we use every day, English that we use almost every day, or in other words, some very common English. And our context today, we are going to be looking at vocabulary related to the dentist. So this is vocabulary that you will encounter and use at the dentist. So let's get on with this. Let's start right now. Oh, okay. I have to slide you down here a little bit, right? Okay, here we go. So here we are. We are at the front desk in a dentist office, at the front desk in a dentist office. And I encourage you, or I recommend that you do your best to kind of repeat after me. Okay, I'm going to read these sentences and these questions, and just do your best to repeat after me. It's a very good exercise. Reading out loud like this is a great exercise for all of you. It helps with your pronunciation, but not only with the pronunciation, but it also helps you with the general flow and the fluency as the words come together and flow together. Okay, so yeah, just do your best to repeat after me on all of this. Okay, I'm not going to read exceptionally slow, but I'm also not going to read super fast or anything like that either. So just so you know. So here we go. At the front desk in a dentist office, receptionist says, "Hello, please sign in. Have you had any changes in your health recently?" "Hello, please sign in. Have you had any changes in your health recently?" The patient replies, "No, I haven't had any changes this year." "No, I haven't had any changes this year." Receptionist, "Do you still have the same dental insurance?" "Do you still have the same dental insurance?" "No, my company changed our insurance. Here's my card, my new dental insurance card." "No, my company changed our insurance. Here's my card, my new dental insurance card." "Thank you. Our dental assistant will be out to get you shortly." "Thank you. Our dental assistant will be out to get you shortly." "May I use the restroom first?" "May I use the restroom first?" Yes, the restroom is down this hall on the left." Yes, the restroom is down this hall on the left." All right, good job, everybody. We're going to move you down to the next slide here. Okay, so now we have the areas of a dental office, the areas of a dental office. We have the front desk, we have the dental office building, we have the waiting room, We have an exam room or an examination room. We have the dentist's private office, and we have a panoramic X-ray room. Again, we have the front desk, the dental office building, the waiting room, the exam room, the dentist's private office, and the panoramic X-ray room. All right. Areas of a dental office. We're sliding you down to some dental vocabulary. Dental vocabulary. We have dental instruments. Dental instruments are tools that dental professionals use to provide dental treatment. Tools that dental professionals use to provide dental treatment. You have an X-ray machine and X-rays. X-ray machine and X-rays. These are images of your teeth that your dentist uses to evaluate your oral health. Images of your teeth that your dentist uses to evaluate your oral health. And just to be clear, the X-rays are the images, and the X-ray machines are the machines that take those images or that generate those images. Okay. Now we have a mouth prop. A mouth prop is sometimes called a bite block. A bite block. This is a device to hold the mouth open that helps the dentist reach the patient's teeth. A device to hold the mouth open that helps the dentist reach the patient's teeth. We have a dental hygienist. A dental hygienist is a person who is trained and licensed to clean teeth, take dental x-rays, and provide related dental services and care. A person who is trained and licensed to clean teeth, take dental x-rays, and provide related dental services and care. All right. Great job, everybody. Now we have different types of dentists. Different types of dentists. We have a general dentist. A general dentist is responsible for the diagnosis, treatment, management, and overall services related to patients' oral health needs. A general dentist is responsible for the diagnosis, treatment, management, and overall services related to patients' oral health needs. We have an orthodontist. An orthodontist is a dental specialty focused on aligning your bite and strengthening your teeth. Examples of treatment include braces, clear aligners, and removable retainers. An orthodontist is a dental specialist focused on aligning your bite and strengthening your teeth. Examples of treatment include braces, clear aligners, and removable retainers. An endodontist. An endodontist is a dental specialist who focuses on complex tooth problems that primarily affect tooth pulp, the nerves, blood vessels, and other tissues deep inside each tooth. Procedures include procedures such as root canal. Okay, an endodontist is a dental specialist who focuses on complex tooth problems that primarily affect tooth pulp, the nerves, blood vessels, and other tissues deep inside each tooth. Procedures such as root canal. Prosthodontist. Prosthodontist is a dentist who specializes in treating complex dental and facial matters, making teeth replacements such as crowns, bridges, dentures, and more. Prosthodontist is a dentist who specializes in treating complex dental and facial matters, making teeth replacements such as crowns, bridges, dentures, and more. Pediatric dentist. Pediatric dentist is a dental specialist dedicated to infants, children, and adolescents. Pediatric dentist is a dental specialist dedicated to infants, children, and adolescents. And finally, we have a cosmetic dentist. A cosmetic dentist is the branch of dentistry that focuses on improving the appearance of your smile. Examples: tooth whitening, dental bonding, and veneers. The branch of cosmetic dentistry is the branch of dentistry that focuses on improving the appearance of your smile. Examples: tooth whitening, dental bonding, and veneers. All right. Excellent, everybody. Excellent. We have common dental problems. Common dental problems. Swelling. Swelling is also called inflammation. Inflammation. Cavity. Cavity. Dental pain. Dental pain, like a toothache. Toothache. Sensitivity. Sensitivity. Crooked teeth. Crooked teeth. Gap in teeth. Gap in teeth. Or we could say gaps between teeth. Gaps between teeth. Bleeding gums. Bleeding gums. Abscess. Abscess. Tooth decay. Tooth decay. Bad breath. Bad breath. Oral cancer. Oral cancer. Dental trauma. Dental trauma. Toothache. Toothache. Chipped tooth. Chipped tooth. Gingivitis. Gingivitis. And impacted tooth. Impacted tooth. Common dental vocabulary. Common dental vocabulary. Toothbrush. Toothbrush. A cap. Cap or a crown. Crown. A water pick. Water pick. Mouthwash. Mouthwash. Toothpick. Toothpick. Dental floss. Dental floss. Toothpaste. Toothpaste. Fillings. Fillings. Novocaine. Novocaine. A drill. Drill. Nitrous oxide. Nitrous oxide is called laughing gas. Laughing gas. And fluoride. Fluoride. Okay. Now we have a conversation between the patient and the dentist. A conversation between the patient and the dentist. Dentist. How are you doing today, Mr. Smith? How are you doing today, Mr. Smith? Patient. Not that great. My back tooth is hurting. Not that great. My back tooth is hurting. Which tooth is hurting and how long has it been causing you pain? Which tooth is hurting and how long has it been causing you pain? The patient points to his tooth and says, for a couple of days. The patient, He points to his tooth and says, "For a couple of days. Let me take a look and then we will take some x-rays. Let me take a look and then we will take some x-rays. Does it look like there is a cavity? Does it look like there is a cavity? I'm not sure, but the x-ray will give us more information. I'm not sure, but the x-ray will give us more information. We have your x-ray, and it shows that you do have a cavity. We have your x-ray, and it shows that you do have a cavity. Can you fill it today? Can you fill it today? Yes, we could squeeze you in. Yes, we can squeeze you in. Thank you very much. Thank you very much. I'm so glad that we could help you today. Have a great day. I'm so glad that we could help you today. Have a great day. Okay, let's briefly review what we have looked at today, some of the vocabulary. Okay, so we have dentist, dentist. We have a dental hygienist, a dental hygienist. We have dental instruments, dental instruments. We have x-ray, x-ray, and a panoramic, panoramic. We have a mouth prop, toothbrush, toothbrush, a cap or a crown, a water pick, water pick. We have mouthwash, mouthwash, dental floss, dental floss, toothpaste, toothpaste, fillings, fillings, Novocaine, Novocaine, drill, drill, nitrous oxide. Nitrous oxide is, we call it laughing gas, laughing gas. Fluoride, fluoride. You have the exam room, and the waiting room, the waiting room. Okay, let's look at some discussion questions here. Okay, my first question, let me move you down here just a little bit here. Yeah, that's better. Okay, so my first question for you is dental insurance expensive in your country? Is dental insurance expensive in your country? In my country, the United States, yes, dental insurance is expensive in the United States. Dental treatment and is in general expensive here in the United States. But what about your country? Is dental insurance expensive in your country? Is dental insurance a benefit for employees in most companies? Is dental insurance a benefit for employees in most companies? Here in the United States, I don't think so, actually. In most, definitely in some, yeah, definitely in many, actually, but in most, I don't think so. Medical benefits, general medical benefits are very common for employees, and dental insurance is also relatively common. But here in the United States, I don't think it would be the majority of companies that give dental insurance as a benefit. What about you? And what about you? And what about in your country? How does it work there? Number three, in your opinion, should companies be required to give their employees health and dental insurance? Why or why not? In your opinion, should companies be required to give their employees health and dental insurance? Why or why not? Oh, okay. Well, for me, I always give the "it depends" answer, uh, because I think a lot will depend on the specific job, and also the I think in general, yes. I think in general, yes, but I think it would depend on the specific job that the employee is performing, and also upon the salary that particular individual is receiving. So, having said that, my general answer would be yes, but understanding that there would be, I believe, some reasonable exceptions to that. But what about you? Do you agree with me? Do you disagree with me? Or what do you think about all of that in your opinion? Number four, in your country, how many times a day do most people brush their teeth? In your country, how many times a day do most people brush their teeth? Well, here in the United States, I think most people brush their teeth 2 to 3 times a day. So yeah, I would say in the United States it would be 2 to 3 times a day, at least twice, uh, probably most 3 times a day. What about your country? What about your country? What do dentists do to make going to the dentist fun for children? What do dentists do to make going to the dentist fun for children? Here, I don't think anything. I don't think going to the dentist is fun for anybody. And I don't think there's a lot that can be done to make it fun for anybody, children or adults. But um, because obviously they can't give them candy, or they can't give them special treats, really, unless it's sugar-free candy or something like that. But I don't know. Maybe they could decorate their offices in certain ways that are kind of cheery and bright, and maybe have some fun kind of happy music or something like that. Maybe have TV with animated movies or animated like cartoons or something like that. But yeah, that would be my answer. Um, but can you think of anything else? Can you think of anything that can make going to the dentist fun for anybody? It's an interesting question. And number six here, would you rather, here I'm asking about your preference, okay? Would you rather have a tooth pulled or filled? Of those two choices, having a tooth pulled or having a tooth filled, what would you rather have? What is your preference of those two bad choices, of those two very negative experiences? Which would you rather have? Well, me, I think having a tooth filled is less painful than having a tooth pulled. Having a tooth pulled can be extremely painful. So I would have to go. I would rather have a tooth filled than have a tooth pulled. But hey, what about you? What would you rather have done to you? All right. So that's going to wrap it up for our live class here. I want to thank you all for attending the CINCILINGUA membership live class. I always want to thank you all for attending our classes, and I want to thank you all for being members, as I always do. At the end of all of my classes, or I always try to make time just to encourage all of you to continue attending the live classes. I enjoy having you with me here. And I also want to encourage all of you to use the resources that you have on the website. You have books to read. You have books to listen to. Listen to those books. It's a great way to learn different things and also develop your listening comprehension skills. You can use those audiobooks also for to practice your speaking and your pronunciation. And what do we have? We also have games. These games are like quizzes. You take these quizzes, and as you're doing these, of course, you're reinforcing information, you're learning new things, and you're also able to compete among your fellow members with these games that we have. We call them Kahoots. And finally, we have a whole bunch of videos in the library for you, and we're adding to those regularly. And so check out those videos and, check them out. We have lesson videos in there. Those are a little bit shorter. We put these live classes in there. It usually takes about a week to get those in there. So this live class will be in there next week sometime, I'm sure. And we have other kind of videos in there. So check those out and make use of them. So on that, everybody, again, my name is Todd, and I am here in Cincinnati, Ohio, and I am looking forward to seeing you all again next time. And I'm wishing you all a wonderful remainder of your day. Bye-bye.